Hello and welcome back to AMR Unplugged, the podcast that has been brought to you by React Africa, raising awareness on antimicrobial resistance. Today, I am outside the React Africa offices, fleeing from the heat of Lusaka, with a lovely guest who's coming all the way from WaterAid. He serves there as a public health advisor. His name is Dr. Collins Himabala, and I'm your host, Musonda Lamba. Doc, welcome.
Thank you, Musonda, and welcome, viewers.
Welcome. So, I have an icebreaker question for you before we start the conversation, and it reads like this. Imagine there was a medal for best hygiene habit, okay? What habit of yours would win this award?
Wow. Okay. Which one would win the award? I think I would go for hand washing every time after using the toilet.
Oh, okay.
Yes.
That's the one that would win best hygiene habit.
That's the top.
Okay. All right. So I think we've already alluded to the fact of the conversation that we're about to have, which is premised around hygiene. And the big concepts are WASH and IPC. But for the sake of our listeners who may not have a health background or would be wondering what is WASH, maybe they think it's washing as in washing their hands. So what would you say WASH and IPC are?
Okay. Yeah, true. I think even for me, I only got to learn about what WASH was much later on in life, in my career. And it's understandable even for a layman. So WASH, it's just an acronym that stands for water, sanitation, and hygiene. So for water, we are talking about clean and safe water. And then the S is for sanitation. We're just basically talking about clean toilets and that are sanitable and usable. And then the H is for hygiene. So hygiene, we're talking about hygiene practices, hygiene behaviors. For example, washing hands with soap. That's part of it.
Okay.
And then when we talk about IPC now, IPC stands for infection, prevention, and control. So infection prevention is self-explanatory, I think.
Exactly.
Yeah, so we are trying to prevent infection. But mostly IPC is used in the setting of healthcare facilities where we want to ensure that we prevent the existence of infections. And then the control part is for ensuring that the infections that are there are controlled and are contained so that they don't spread to other patients or other parts of the hospital.
Okay. So from what you've explained, I get the gist that this is very important. But why is it important? Why is it important? Everything you've highlighted from what WASH and IPC stand for, why is it important to an individual? Why is it important to a community? Why is it important to the facilities? I think you mentioned something about facilities. Why are these two, WASH and IPC, so critical?
Absolutely. Thank you for that question. So, we do know that charity begins at home. An individual or individuals make up a household. Households make up communities. Communities make up a nation. The nation make up the global world. And so all the interventions that relate to our WASH and IPC cut across all these individuals. And we also find that these individuals are found in different spaces, for example. So when we talk about a household, we want to ensure that each household has clean and safe water so that we prevent diarrheal diseases. We also protect the children from contracting diarrheal diseases or infectious diseases from the home. We want to ensure that the pregnant mothers or those that have just delivered, they are able to be protected from infections. And then we cross over to communities. Communities, we want to ensure that we stop talking about cholera outbreaks year in, year out. We cannot be doing this. European countries have moved ahead.
Right.
Cholera is a thing of the past now. And Zambia is able to do that and achieve that as well, and many other African countries. So curbing the scourge of cholera outbreaks and other diarrheal diseases like typhoid, even Ebola that is aching our continent. These are part of the things that can help to prevent all those infections. Still in the communities, we can also talk about school-going children. Here's a girl that is just attained menarche, and she fears to go to school because there are no services to provide for her sanitary needs. And so she has to miss school for those days that she's attending. So WASH and IPC comes in to ensure that menstrual hygiene management is taken care of, this girl can freely go to school even when she's on her menses and attend to those classes and not miss out. So equal issues of gender equality and inclusion are also captured there.
Wow.
At national level, we want to see that policies and all the decisions that the countries are making are pro-WASH and IPC. Why? If the country is able to prevent diseases, they are able to save money on the costs that they would have incurred to treat these diseases. And some of these diseases are actually resistant to the, conventional antimicrobials. So if we are preventing the infection itself right from the start, then we don't have to worry about AMR. And that is huge savings on the part of the nation. And you'll find that there'll be more money that can go towards economic growth and other developmental aspects. So you can see that actually WASH and IPC is very important and very key in covering all aspects of our lives, from the household to the community to the national level. Before I forget, let me mention the hospital setting.
Yeah.
Because we do know that the hospital is a place where we go to get care. But now imagine a situation where the hospital becomes your enemy and it becomes a place where you contract infection. I go to the hospital for a headache. And then because maybe the IPC measures at the hospital are not so top notch, I end up contracting TB from someone who was sitting next to me who was not isolated.
Yeah.
Or maybe I used the bathroom and touched somewhere and it was not cleaned so well. I contracted diarrheal disease. That shouldn't be. A hospital is a safe place which is meant to protect us and heal us from diseases. And so if WASH and IPC is not implemented in the healthcare facilities, it will become a breeding ground for more diseases and even antimicrobial resistance.
Wow, that's such a well-rounded response that you've given. You've touched so many. You touched on gender, intersectionality. You talked about diarrheal diseases. You talked about TB. You've touched on even menstrual health. I think that was a very important aspect that you have brought out in your answer to that question. So the last part of your response touched on my interest in this conversation this morning, which is the link between WASH and IPC and antimicrobial resistance. Um, how would you explain? How would you break down that link? What is the real linkage between WASH and IPC and antimicrobial resistance?
Okay, thank you so much. So, I would like to give an example. So here is a family that wants to take their children to a play park. And then at the play park, you find a huge notice in red saying, the equipment here has not been maintained for the last 5 years. And so enjoy the facilities at your own risk. So you'd be scared to go there, right? Yeah, you wouldn't want your children to go there. And what do you think would be the best measure to prevent or to ensure safety for your children? Is to ensure that they don't ride those things in the first place. Yeah. And so IPC and WASH is basically the instruction that is helping us, or the decision that is helping us not to get onto that roller coaster ride. Because we know that that roller coaster ride is unsafe and it's costly, because there might be death, there might be illness or breaking of legs that will cost us hospital bills and other things. And so WASH and IPC are there to prevent infection. Because if we don't, infections will come. When infections come, we'll end up with the increased use of antimicrobial drugs. The increased use of antimicrobial drugs is what is predisposing people to AMR, because the bugs now in the body are predisposed to all kinds of drugs because of increased use. But now, let's reverse that cycle. If we are reducing the number of infections in the first place by ensuring that we have water that is clean and safe, we have toilets that are sanitable, they are clean and safe to use, we have hygiene behaviors that are implemented across the facilities by everyone, then definitely the number of infections that we'll see will reduce.
Right.
The reduction in the infections will then contribute to the reduction in the use of antimicrobials, because we'll only have to use antimicrobials for things that can't be prevented by the simple measures that we've talked about.
Right.
And as a result, IPC becomes important because now we are cutting all these costs that the government would have had to incur if somebody fell ill in the first place. I can tell you, and I'm sure you've also heard and read, that the drugs that we use when somebody has antimicrobial resistance bags in them uh, are quite expensive. So you can imagine cutting down that cost and avoiding it altogether by just implementing simple measures like hand washing, for example, masking up, keeping up social distance, all these things. I think we can do better in our country.
You know, the last sentence where you were talking about masking up, washing hands, during COVID here in Zambia, as I know that it was maybe implemented in other countries as well, there were strict government regulations to make sure that there's adherence to things like washing hands, ensuring social distancing. But now, since that wave has passed, we've sort of gone back, gone back on those practices, which are key, to disease prevention. And as you were speaking, I also remembered a quote that said, hand washing saves lives. Like, it sounds so simple, but from the explanation that you've given, a simple practice as just washing hands, masking up, maintaining social distancing can help in curbing some of these diseases. And as a result, you don't need to use the medication.
That's right.
And so I think that was a really good answer. And thank you so much for taking it on. There's another aspect of your question, of your answer, where you talked about more even from the economic side of things, that it would cost the government less if they put WASH and IPC measures in place.
That's correct.
Yeah, so I'm thinking SDGs, Sustainable Development Goals. How can WASH and IPC link? What's the linkage between these two? The UNGA Declaration on AMR has put forth two commitments, basically, that are specifically targeted towards WASH and IPC.
Right.
So I'm wondering, in the greater conversation at that global level, what is the link between WASH and IPC and the Sustainable Development Goals?
All right. Thank you so much. I think we all know that we are a global village. And in the global village, you don't want to be that household that is, defiant against the headman's rules. And us being a member country or member countries of the UNGA have ascribed also to the SDGs. And actually, I took time to read the 17 SDGs.
Oh, that's good.
And most of them actually are connected to WASH.
Could you mention some of those?
So, for example, SDG 1 is talking about no poverty. It's also linked to SDG 8, which is talking about, quality work and ensuring that people have access to good work. So, already you can see the link that we're talking about economic value to the country. So, if somebody's sick, they are not able to contribute to the economy because they are sick. But if we implement WASH measures, we ensure that this individual is healthy and they are able to contribute to the economy. And so there will be no poverty and there will be quality work.
I see it.
SDG 1 and 8 covered right there.
Yeah.
SDG 6, on the other hand, speaks directly to water, sanitation, and hygiene. And we want to ensure that there's universal access to water and quality sanitation for all by 2030. And so already there's a direct link to WASH services there. And then we talk about SDG 3, which is talking about maternal, neonatal, and child health mortalities to ensure that those are reduced by 2030. And so if we are to contribute to the reduction in the infection in the neonates, in the mothers that are delivering, we have to ensure that IPC and WASH measures are also implemented. So we are contributing to SDG 3. SDG 8 also talks about climate change. In our work, part of our work as WaterAid is to ensure that we provide climate resilient WASH services in the places where we're implementing activities. And of course, this is where the whole world is moving towards, ensuring that climate responsive activities are being done across all our work and our implementation. If we ensure that those things are implemented, definitely IPC and WASH becomes important because we'll now be creating communities that are resilient, not just on the health aspect, but also contributing to climate response. The last one that I would like to talk about is SDG 4. We talk about that. It talks about quality education. And remember, we had spoken about a girl child not being able to go to school because of poor menstrual services at the facility. So if the schools are able to take up wash work in their schools and implement menstrual hygiene management for these girls, there will be quality education provided to this girl. So we can see that all the SDGs actually are contributing in a way, directly or indirectly, to WASH and IPC. And these are interrelatable and actually simple measures that can contribute to big results.
Yeah. Firstly, I would like to commend you for actually taking the time to go through all the SDGs and see the linkage. It was a refresher for me also on some of them. Like, oh yeah, I see how that would connect, especially the education one. So yeah, just thanks for that perspective as well. You've sort of framed a case for policy for the government officials. Let's say if someone was listening to us from one of the ministries,
Yeah.
let's say. Why is it critical for them to prioritize WASH and IPC? And in case they missed something, what's the risk if they don't?
That's a big question. And I want to think that's the $1 million question.
It's the $1 million question.
Because if you and I are just talking about IPC and it ends here, then it will just be you and I.
Yeah.
And probably the people that we relate with. But if a policymaker takes that up, these are the decision makers. These are the people that advocate for the projects to be implemented in our communities. And so if they are aware and they take on these aspects, then definitely our country will be a whole lot different. So we had already spoke about the interrelatability between infections and IPC and WASH. So if we ensure that we implement IPC and WASH services in our households, in our communities, in our hospitals, and as a country, and these are taken on into policy, then this will ensure that we are reducing the number of infections in our societies. Reducing the number of infections equates to the reduction in the number of hospital admissions. The reduction in hospital admissions means the government doesn't have to spend so much in accommodating and treating all these people that are coming to the hospitals. And again, we also talk about the healthcare workers. On the healthcare worker side, if there are a lot of people that are coming into the hospitals for infections and other things that are related to preventable diseases, it means we have to accommodate salaries and pay for these workers that are attending to patients. That's another huge cost for the government. But if we are able to prevent these infections from coming to the hospital in the first place by implementing these simple wash measures from our households, in our communities, in our schools, then definitely we'll save a huge budget from our national budget that was supposed to go to treating these infections. And that provides for more money for developmental projects and moving our country forward. You can imagine most of our African countries, they are 20, 30, 40, 100 years behind in terms of development compared to other countries in the East and in the West. And that is because they have moved forward from trying to, treat diseases, but moved back and ensured that they prevent these diseases and infections from happening in the first place through providing clean water, sanitation, and hygiene services. Yeah.
Thank you so much. In closing, if someone has missed the key points of what you were laboring to bring out, how would you sum up our conversation today in just 2 sentences? I hope that's not too much work. Yeah. So that what's the key takeaway for the listeners and the people who are watching us today? You can even look straight into the camera for
Sure.
this.
Thank you. Yeah. Indeed. So, dear listeners and viewers, WASH and IPC is something that is critical. And we almost always tend to view it as something that is so distant and not related to me. But remember, we spoke about charity beginning from home. And so, as an individual, you can contribute to the reduction in the number of infections. You reducing in the number of infections will contribute to the reduction in hospital acquired infections and hospital admissions. You contributing to the reduction in hospital infections and admissions contributes also to the fight against antimicrobial resistance. And also you save the money for the country at a greater stage. And so we all can contribute in a way. Me washing my hands, me masking up will safeguard my neighbor from contracting a disease. And I think we saw this happening during our COVID-19 pandemic. We were all masking up, we were all washing our hands, we were maintaining distance. And we saw a reduction even in the number of the common flus. Yeah. And so it just shows that a little contribution by an individual multiplied by 100 individuals, the entire nation doing the same, would really make a huge difference. And so the time to act for you and me is now.
The time to act for you and me is now. I think that's a perfect closing line. And with that, I really just want to say thank you. Thank you for making the time to come out here and have this very important discussion and conversation on WASH and IPC. Myself, I've learned a lot, especially the perspective of education and how it ties with the SDG and the girl child. I think for me, that's one of my takeaways from today's conversation. I surely hope that our viewers have also picked up one or two things. And so thank you so much for coming.
Thanks for having me.
And to our viewers, we really thank you for staying up to the end of this video. This has been AMR Unplugged with your host, Musonda Lamba. And I would like to encourage you to follow our social media pages. Make sure you subscribe to our YouTube, where this podcast will be uploaded. Thank you.